I'm a municipal health officer under the Doctors to the Barrios program of the Department of Health. The Doctors to the Barrios program is a program of the Department of Health that deploys doctors to far-flung, doctorless municipalities in the Philippines. So these municipalities are usually in geographically isolated and disadvantaged areas. Quezon is one of 3 municipalities in Alabat Island, so it's an hour boat ride away. People here, mostly they live on subsistence fishing and farming. Poverty incidence is high. So being a relatively remote island municipality, access is one of the main problems in terms of health service deliveries. Before being involved in the National Telehealth Service Program, it was a challenge to us how to refer our patients to specialists because most of them cannot afford going all the way to the mainland and paying for the professional fees of the doctors.
The National Telehealth Center is part of the University of the Philippines, Manila. It's a research and development unit, and it focuses on the use or the development of ICTs or information and communications technologies for healthcare. So telehealth was really born out of the need for access to better care because of the geographic challenges as well as social challenges. The Philippine Statistics Authority continued to state that 60% die without seeing a doctor. So it's a telemedicine platform. It's intended for primary care clinicians out in the field. They are linked to clinical specialists who are urban-based in medical centers and a technology that connects them so that they can communicate.
Using the National Telehealth Service Program, I refer the patient via text or through their web-based app. I give the details about the case. I get a response that will give me either advice on the diagnostics that I need to order or the medications that I can give to the patient. Because they also know their network, they can give advice as to where we can bring the patient or the nearest consultant in the area. The program is innovative because it has given us a new way to give a service to our patients. So those of them who otherwise cannot access that service, now they can get a specialist level of care even if they stay here in the municipality. Here, in settings like this, giving the best care to our patients is not just actually a clinical exercise, but also entails developing the system as a whole and also pushing for innovations. There are still so many gaps in delivering quality health care to people in the Philippines, especially in the rural and remote areas because of the inequities. Like urban centers are progressing while the remote rural areas are lagging behind. And social innovation can help bridge that gap.